Type 2 diabetes is often explained in very simple terms as too much sugar causes diabetes. But medically, that explanation is incomplete because type 2 diabetes is not caused by a single food and is not caused by sugar alone. It develops over time through a combination of well-established biological and lifestyle factors. At its core, type 2 diabetes is a condition where the body becomes resistant to insulin. Insulin is the hormone that helps move glucose from the bloodstream into the cells for energy. When the body becomes resistant to insulin, glucose begins to build up in the blood. Over time, this leads to chronically elevated blood sugar levels. The strongest and most widely accepted risk factors for type 2 diabetes include excess body fat, particularly around the abdomen, physical inactivity, increasing age, family history of diabetes, and a history of prediabetes or gestational diabetes. Among these, abdominal and visceral fat is especially important because it is biologically active and strongly linked to insulin resistance. Diet does play a role in diabetes risk, but not in the simplified way it's often described. It's not sugar alone that causes diabetes. Rather, long-term excess calorie intake from any source can contribute to weight gain and metabolic changes that increase insulin resistance. This is why diabetes risk is more closely linked to the overall eating patterns, body weight, and fat distribution rather than any single nutrient. Family history also plays an important role. This does not mean diabetes is directly inherited in a simple way. Instead, it reflects a combination of genetic predisposition and shared environmental factors such as diet, patterns, and physical activity levels within families. Type 2 diabetes usually develops gradually. Before diagnosis, many people go through a long phase called insulin resistance. During this stage, the blood still produces insulin, but cells respond less effectively to it. The pancreas compensates by producing more insulin. Eventually, this system becomes overwhelmed and the blood sugar levels begin to rise consistently. So, the clearest way to understand type 2 diabetes is this. It is not caused by sugar alone. It's a metabolic condition driven mainly by insulin resistance, influenced by body fat distribution, physical activity, genetics, and long-term lifestyle patterns. Understanding this correctly is important because prevention is not about eliminating food, it's about managing the overall metabolic health of the body over time.